Hey guys, it's Gianna, Midwifay. Today I wanted to take some time to talk about a topic that a lot of people have been asking me about, a lot of friends, patients, even colleagues, and that is the concept of place of birth. Now I know this can be a little controversial when talking about deciding where to birth. I want to say that I don't have any particular opinions on where you should or should not give birth to your baby. I just want to lay out kind of the three main places of birth, if you will, that you have options for. Those three options being hospital, freestanding birth center, and home birth. I think a lot of times when people get pregnant in the Western world, I'll say, automatically most people default to and think about the hospital. That's what we see in that's what we see on TV. That's what we see social cultural norms most of the time. Most people were born in hospitals these days. I'm gonna have a video about the history of childbirth in America and how it came to be in the hospital. I'll let you guys know when I put that out. But in general, today in 2021, that's where majority of people plan to give birth. Over 95% of babies in America are born in the hospital. I think a lot of people just default to that and don't even know that there are options that you can give birth in other places. As I mentioned in my intro video, which I will link below, I personally have worked in freestanding birth center settings as well as hospital L&Ds and hospital birth centers, which I will kind of explain what that looks like. Again, in this video, I'm not trying to be controversial. I don't want to share specifically opinions or risk status. I just want to kind of go over the positives and negatives of the different birth environments that you have available to you. Okay, so let's first talk about the default, which is hospital birth. Over 95% of babies in America are born in the hospital these days. What does that mean, right? That means, obviously, you go to a hospital and you deliver your baby when you're in labor. So hospital births, there's a variety of different types of hospitals. There are large HMO facilities. There are teaching hospitals that have residents and medical students. There are small private hospitals. Usually people pick their hospital based on their insurance coverage and what is considered an in-network hospital for them. When you deliver your baby at a hospital, you can have your birth attended to by an OB/GYN physician, by a family medicine physician, or by a nurse midwife. I don't know the exact stats because it varies state to state, but in America today, most hospital births are attended by OB physicians. There's a small percentage attended by family practice doctors, and a small but growing percentage delivered by nurse midwives and midwives that work in the hospital setting. When you choose to give birth in a hospital setting, usually that means you go to your OB provider in a clinic setting for your prenatal care. You know, they see you after you've had your first missed period, they confirm your pregnancy and do your ultrasounds and all of your tests. Usually those clinics you will see an OB, family practice doctor, midwife, nurse practitioner, physician assistant. There's a variety of different providers you can see in the clinic setting. And then when it's time to actually deliver your baby or go to the hospital, that's when either the OB or the midwife with the group is on call for your birth. If you didn't know that midwives can deliver babies in hospitals, I'm happy to tell you that that is true. Please look into your insurance, look into the hospitals in your area and the practices in your area. Again, hospital-based midwifery is a growing, it really is a growing phenomenon. And so I encourage you to look into your insurance, look into the local clinics and local hospitals to see if it's an option for you to have your birth attended by a midwife in the hospital. Let's go through the positives of hospital birth. A huge one is it's often paid for by insurance. Again, I mentioned a lot of people choose their hospitals in the beginning based on what their insurance coverage is. So this is a really big one. This is part of the reason why it's the default, because insurance automatically pays for it. It's considered part of a normal medical care that you might get in your maternity care. So that's, to be honest, probably why it's the default. It just is easily paid for by insurance, especially when you're going to an in-network provider. Another huge positive of giving birth in a hospital setting is access to pharmacological pain medications. Pharmacological pain control options include medications. So the most popular of which is the epidural. A labor epidural is administered by an anesthesiologist or a nurse anesthetist. It gives you continual pain control throughout your labor. Those can only be offered in a hospital setting. Other pain control options are IV pain medications. Typically those are offered. There's a variety of different types that are offered in the hospital setting, as well as something called nitrous oxide, which is increasingly being offered in the hospital setting and can be offered in some out-of-hospital settings as well, but is mostly offered in the hospital setting. So I think another positive that a lot of people look at with hospital birth is the option for pharmacologic or medication drug-based pain control in labor. And kind of the last big positive that I think makes hospital birth be perceived as safer or safest is access to the OR and to NICU teams quickly and if we need them. So, you know, labor and delivery units typically, depending on the hospital and how big it is and location, have their own ORs separate from even the main OR of the hospital. They also have NICU teams, or at least special baby nursery teams, to care for babies that need assistance or adjustment. Again, it depends on your hospital setting. If you're in a large hospital, teaching hospital, small private community hospital, but most hospitals with good sized labor and delivery units have their own separate OR spaces, specifically where OBs do C-sections and other urgent or emergent obstetrical procedures, including repairs of really bad tears that may take place. They also, you know, there's also access to NICU teams. NICUs have levels of care depending on the gestational age of the fetus. But most hospitals, if they don't have an actual NICU, have at least special baby nursery teams ready to take care of a baby that may need some extra support at birth. Again, I say that this is one of the positives of the hospital setting, but it's a perceived safety benefit when, you know, in reality, a majority of normal, low-risk pregnant people do not need a major intervention such as something that takes place in the operating room, or most full-term babies do not need full NICU support. However, there definitely are cases where unexpectedly this does happen, or there's been risk factors identified throughout the pregnancy that deem that, you know, both mom and baby or one of the other need to be in the hospital setting for the safest thing for their birth. Some negatives of the hospital birth setting are the variety of interventions and policies and procedures that you have to experience just by being a patient in the hospital. The mere act of leaving your home to check into a hospital, to answer several questions at a desk, to then meet a nurse and answer more questions and have an IV placed and be on the monitors. And I mean, I will have several videos throughout this channel addressing L&D and common interventions. There are some that are done with a true risk-benefit calculation and some that are just done because this is a hospital and this is the way it's done. That can be a negative because it doesn't take into account each person's story, goals, desires for their birth. You can imagine if you show up in labor super uncomfortable and you're having to go through all these steps, you know, that's kind of a drawback. However, if you want your epidural, you know, you're going to do what you need to do to get that epidural. So I'm not necessarily saying that these negatives outweigh the positives for every person, but there are several interventions and things that we do to patients in the hospital just because you're a patient in a hospital that can be seen as a negative. Another negative and downside of delivering in the hospital is the lack of continuity of care. I think this is something that people don't necessarily know about or understand until they get pregnant themselves. Again, as I mentioned, you go to your OB practice for your visits, you see the OBs, you see the midwives, you see the nurse practitioners, whoever you see. However, when you're in labor, you don't know who's going to be on call, so hopefully you've met almost all of the providers in your practice, depending on the size of the practice, whoever's on call is going to be who's there when you birth your baby. And also there's this variable of the labor and delivery nurse, who I was a labor nurse, I work with labor nurses, I think they're amazing. However, you've never met this person, right? So you know your doctor, you know your midwife, you've never, most likely, unless you've been to the hospital before for some reason, you've never met this nurse that's really going to be with you 60, 70, 80% of your laboring time. Your OB or your midwife, typically midwives are there a little bit more, but your OB will only really be there when the baby's being born. So that lack of personalized continuity of knowing who your person is when you come into the hospital, that's another possible negative of giving birth in a hospital setting. As soon as I recorded this video, I realized it was so much information into one, so I decided to split it up into 3 different videos. So you just heard about hospital birth. The next one, part 2, is going to talk to you all about freestanding birth center birth. All right, I'll see you there.